Great. Well, thank you for everyone who's able to join us, and for all those who are later watching the recording. We had a few technical difficulties earlier. I think some folks were having some trouble getting on to the meeting. Some folks were having some issues with getting an invalid meeting ID error. So if that's you, hopefully you realize the recording was available later. You're able to join us at a later point. Apologize for any difficulties or inconvenience that may have caused to anyone. So what we'll do is, we're very excited for today's session. The title of today's session is So You're Thinking About Therapy. We're going to take a kind of a deep dive looking at what is therapy, what's the therapeutic process like, what can you expect from therapy. Anybody who's had to do therapy for the first time or who's thought about it knows that it can be an intimidating process, right? To first experience, first off, to pick up the phone, pick somebody and call them and hope you get a phone call back. But also, once you've started therapy, to figure out where is this going and why am I paying money to be vulnerable to a stranger and what is that all about? So hopefully today, some of the things we'll talk about will give you a little bit of a baseline so you can know what to expect and hopefully remove some of that discomfort from the process for you so that you can experience the benefits of therapy without some of the bumps in the road that sometimes come along with it. So just some housekeeping. So today's event is hosted by the Connective C Coalition. So the Connective C Coalition is dedicated to increasing accessibility to mental health services for Orange County young adults and their families by networking them to local community mental health resources. So Connective C supports young adults directly through stigma-reducing events, an online resource directory, and community events calendar, and a monthly coalition meeting. You can find out more information about all of those at connect-oc.org. We'll be talking a lot throughout today's session about resources that are available and the importance of utilizing those resources that are here for you in the community. Sometimes it makes sense to go to a therapist who's working in private practice and all of that, but sometimes that can come with a higher level of cost. And so what are some of the local resources that you can make use of that might work better for your budget while also being able to get you the care you need? So a great place to start is the resource directory on connect-oc.org. Connective C is also a program of Partners for Wellness. So Partners for Wellness empowers communities to take action through collaboration, education, and advocacy. Our goal is to create healthier communities. And you can find out more about Partners for Wellness at partners4wellness.org. Connective C Coalition is funded by the OC Healthcare Agency, Mental Health and Recovery Services Office of Suicide Prevention, and the Mental Health Services Act, Prop 63. So today's event, as I mentioned earlier, is being recorded and will be made available on the Connective C website, and give us maybe about a week or so to get it set to go and uploaded. And then we'll be sharing a survey link later on in the webinar chat. Consider offering your feedback. It's always helpful for us to make sure that we are offering events and programming that is useful and that makes sense and that is effective. So offer your feedback, and you'll also be entered into an opportunity drawing to win a gift card. And then finally, if you have any questions during today's event, please post them in the Q&A. Since it's a webinar style format, we have a section specifically dedicated to Q&A. And so we'll be sure to set some time aside to get to those questions later on in the event. Here's what we're going to look at today. We're going to look at what to expect from therapy. We're going to look at how to find a therapist, different types of therapy that are out there and what is the value of those. The importance of a culturally competent therapist. What does that mean, and why is it important to bring in culture into therapy and to have a therapist who is both willing to do that, but also willing to do the work to know how to do that? And then what does success look like in therapy? Anybody who's coming to therapy is hoping to gain some benefit. So what does that mean? What might that look like, and what might be a reasonable expectation in regards to that? So without further ado, I'm very excited to say that our guide for this conversation will be Dr. Jacqueline Mack-Harris. Jackie, I know you in a particular context as a professor at Hope International University, but I was hoping that maybe you could give us just a kind of rundown of who you are, your work, what connects you to this topic, and your background.
So yes, I'm Dr. Jacqueline Mack-Harris. I am a licensed marriage and family therapist and associate professor at Hope International University. I'm prior military, my husband's prior military, soon to be son-in-law is prior military, and I have a son-in-law who's active duty right now. And I share all that because that's really kind of where my focus of mental health began, trying to make sense of what was going on with my husband post-deployment. So my focus of research, there's two. One is on reintegration of intimate relationships. And so I studied that for my doctorate degree and came up with a system to help people reconnect post-deployment. Which, by the way, we're all kind of in that process right now, post-pandemic. We're all trying to reintegrate to our lives, and it's extremely challenging. Also, I focus on generational transmission of trauma, and we find that a lot of times we're dealing with some of the struggles we're dealing with in the military because there's a history of certain things, and it just keeps getting passed down and passed down. So I'm a researcher. I'm a therapist. I'm also a mom and a grandmother and a wife of 33 and a half years. My husband is a pastor. We serve at a church out in Riverside. So I'm busy in ministry as well. And before I became a therapist, I was a nurse. So I've got the medical mind as well, kind of backing up my therapy mind.
Nice. Great. Thank you for that. Yeah, this is why I'm so excited to have you. In addition to having taken classes with you at Hope, I'm excited for folks to get a little bit of what we've done in class. So why don't we dive in? So the first kind of question, we're going to break it down into kind of three sections. We're going to look at therapy in general and how to access questions related to that. We're going to look at questions related to self-advocacy in therapy and why that's important to think about therapy as a collaborative process and why your therapist should be thinking that way as well. And then we'll look at the therapeutic process a bit. What does therapy actually look like and what are some things to expect and to be aware of there? So starting kind of with the most broad question, but what is therapy?
So I like that question because it makes you stop and think about the fact that therapy is used in so many different contexts. But here today, we're talking about psychotherapy. But therapy really is just a series of treatments to address a problem. So you could have occupational therapy, you could have physical therapy. You break a leg, you have certain treatments to help you strengthen that leg. So in psychotherapy, we're kind of doing the same thing, but for the brain. And unfortunately, there's a stigma about getting help for your mental health challenges that isn't there when it's any other kind of therapy, right? If you break a leg, you're expected to go to physical therapy. But if you have an assault and you're having a hard time recovering from that trauma, you're weak. And so therapy is a way of helping someone overcome an injury. And in our case, we're doing therapy on the mind, on the brain.
Yeah, that's beautifully put. Yeah. So often we get stuck in that stigma of, that really is what it boils down to, is this sense of, if I can't handle what's happening for me emotionally or mentally, I'm weak. But we don't think that way in any other context.
Any other context. Your pancreas isn't working right. That's not a weakness. You get gallstones, you got to have surgery. You don't consider that a weakness, but for some reason, if you are depressed or anxious or feeling a sense of overwhelm and life's too much, we would call that a weakness rather than the organ that regulates those things needs some help. Just like other organs in the body need help sometimes.
That's good. I know that for some folks, we only go see the doctor when we are in crisis, when we're like, okay, whatever this is, it's probably going to kill me. I probably should go see a doctor now. And it seems that often is true with therapy, right? We tend to go to therapy when we are in these peak moments of crisis, right?
Yeah, and often it's 7+ years later than we should have gone.
Yeah. So should I go to therapy if I'm not in crisis?
Absolutely. So I believe everybody needs somebody to talk to. We heal in the context of relationship. And often the people you are in immediate relationship with are in the situation you're in too. They're a part of your system and they can't see themselves the way you might see them. You can't see yourself the way they might see you. Going to speak to a professional counselor or a therapist can put a mirror up for you and kind of reflect these things back to you. Therapists are trained to understand the things that people say and the behaviors that people have and the beliefs that they have in a different way. We've been trained to understand that there's a special meaning behind that. Certain behaviors are indicators of certain traumas. Certain behaviors or tones are indicators of certain feelings, and we've been taught how to recognize those things. And so if you are meeting with the therapist regularly, whether you've had some big incident or not, whether you think you need to talk to someone or not, having someone just be present with you can help. It can be a form of self-care. You go and get your hair done, you go and get your nails done, whether you're going to the barbershop or the hairstylist, whether you're going to get your nails done at the shop or you're shopping online for whatever the product is, you're still making connections and you're still trying to do something to make yourself feel better in some way. Therapy is just another tool to use to help you feel better, to help you be successful in life in a different way.
That's good. Okay, great. Well, we're talking about psychotherapy. And so when we talk about psychotherapy, we're talking about that process you were just talking about. Talk therapy sometimes is the other word we use. And there's a few different folks out there who do talk therapy, right? There are counselors, marriage and family therapists, social workers, psychologists, to some extent, maybe a psychiatrist, or at least we think of psychiatrists in the realm of mental health professionals. What's the difference between these, and how do I know who I should be talking to?
So we'll start with the psychiatrist. And psychiatrist is a medical doctor, and they are going to be the ones prescribing medications. They've gone to med school, they're doctors, but they are doctors who specialize in the brain and in the psyche, right? Then there's psychologists, and psychologists are doctorate level professionals. They are more likely to do the assessing, heavy assessing to determine things like autism or ADHD, personality disorders. And so the difference between a psychiatrist and a psychologist is the medical degree. And the psychiatrist will spend time with you the way your doctor might, so maybe 15 minutes, whereas a psychologist could meet with you for an hour or more, especially if they're doing a series of testing. If we move on to the professional counselor, we call them licensed professional clinical counselors. They are likely to be doing things like career planning and academic planning, and they might help someone focus who's struggling with some type of substance, but it's really focused on that individual and their challenges. And then the next term that's coming up, or the letters that are coming up for me, is the LCSW, so the licensed clinical social worker. Clinical social workers are focused on social systems. So if there are some issues going on in the family that make you get connected with social services for some reason, say the child ends up being removed from the home, or there are some domestic violence going on in the home, or developmental issues going on, and we need services that the community would provide, county services, you're most likely going to be working with a social worker. The LMFT, the licensed marriage and family therapist, is a very systemic thinking type of therapist. We are focused on the family system, or whatever system the person is in. So it could be, when I think of my clients, I think of their context, their systems, their systemic context in terms of their family, their job, their church, anything that they're a part of is a system. And as a marriage and family therapist, I'm looking at how this person is living their life and how relationships are impacting that. So we're very relational. And so all of us are trying to help people live better lives. We just are coming at it from a different perspective.
That's great. Okay. And so kind of along those lines, I know that when we think about someone we might be speaking to for talk therapy, whether it be the professional counselor or the marriage and family therapist or the social worker, or even the psychologist, um, I guess honing in on the world in which you are in as a marriage and family therapist, but I know there's some comparable reality for the others. What's the difference between a trainee or intern, a therapist who's pre-licensed, like an associate, or a licensed therapist? What's the difference there?
So the difference is the licensed therapist has gotten their 3,000 hours. So they've gone to school, they've gotten their master's degree. If they are a marriage and family therapist or a clinical social worker or a professional counselor, they have to at least have a master's degree. They may go on to get their doctorate degree, but certainly if they're a psychologist, they have that. And the part of becoming an expert in whichever path you're in is getting these 3,000 hours. And in 3,000 hours, that's time you're sitting with clients, and then you have a test you have to pass. The associate or the intern, they're both the same level. It's just some call it intern and some call it associate, depends on states. They are someone who has graduated, so they have their degree and they've gotten enough hours to graduate from their program, but they still need to get their 3,000 hours. So they're in that middle space. The trainee or the student therapist, they are still in school. They haven't got their degree yet, but they've been in school for at least a year. And now they're in the part of their program where they're in practicum, they're meeting with supervisors, they're seeing clients, and they're learning on the job how to be a therapist. You will see your first client in some places. We see our first client after a year of coursework, and you're in the room with your client by yourself, but you've learned, you have a lot of the textbook knowledge. Now it's time for you to be with someone in the room and actually learn how to be in the space of being a therapist and be with another person in their hurt places and in their challenges and walk alongside of them. And most states require us to be doing that for 3,000 hours before we're even allowed to take the test. And once you're licensed, then you're able to do it on your own. You don't have to have supervision. As a pre-licensed therapist, which would be an associate, an intern, a trainee, or a student therapist, all of those require supervision. So if you're seeing someone who is a trainee or is pre-licensed, you're not seeing someone who doesn't have their full licensure and isn't fully trained, who's just out there by themselves. They have to be meeting with the supervisor, and that supervisor is kind of a fly on the wall for them, and they're just making sure that they're following best practices. And so you have that support behind you of having that supervisor viewing these cases as this trainee, associate, or intern are learning and gathering their hours.
That's great. So then should I avoid seeing a trainee or an associate, or do I need to see a licensed therapist, or how does that work?
So I would say not in most cases. Most cases can see a trainee, associate, or a pre-licensed therapist, because if you're seeing a marriage and family therapist, for example, we're very much relational. It's about the interpersonal relationship. There are some diagnosed mental health disorders that we do help treat, but we aren't often working with severely mentally ill. And so if you are dealing with anxiety, dealing with depression, having problems in your relationship, having problems parenting, a kid that's having some issues, you can see a trainee or an associate, because you remember there's a supervisor supporting them and making sure that they're doing all the things that are in our best practices. Their supervisor will also let them know if a case is too much for them. So as a supervisor, if I don't think my associate is competent to see this client, we will refer that client, because we're always going to be putting the client's needs above anything else. And so if finances are an issue, most trainees are far cheaper than licensed therapists. And so if you can see a trainee for $75 versus a licensed therapist for, I don't know, $175, $225, and you can still get great care, see the trainee. Because it's going to save you money, and it's going to also add to the community of therapists, because they get to see you and they get to get their hours, and getting their hours, then they get to go and get licensed, and then we have more licensed therapists.
That's great. You can think of it as, if I'm the person going to see a trainee, I'm giving back to the broader
You're giving
community.
back, you're giving back, you're paying it forward. Yeah. I
Great,
was a
thank you.
nurse before I was a therapist, and I remember going through that as a nurse as well, right? You have to have your first stick. You have to have your first blood draw. You have to start that first IV on somebody. Someone needs to be that person so that we can help our up and coming student therapists and student professionals get to where it is they're trying to go. And at the same time, get the help that you need.
Yeah. Yeah, that's great. And I'm thinking too about, one of the things that folks keep talking about lately is there's such a great need out there for folks to be able to spend some time with a therapist, but we seem to have a bit of a shortage. And so each semester there are new trainees stepping into that role, right? And so there's a new opportunity each semester to be able to see a new therapist, to see someone. There's a new crop of folks out there doing the work.
And often we don't know how bad it is until we're sitting in front of someone. And so the question, how do we know if it's severe? I would say, you need to see someone, so just start with them. And you can start with the trainee, and the trainee, as I said, their supervisor is going to say, this is probably dual diagnosis. They've got multiple things going on and have been dealing with it for a long time. We should probably have them see a licensed therapist. As a supervisor, I'm willing to have my supervisees, my student therapists, see some cases that might stretch them, but I'm not willing to do that at the expense of the client's safety. And so supervisors are really good at determining what their associates and their pre-licensed therapists can handle. But also, as a trainee therapist, I remember sitting with someone and realizing this was out of my scope. I don't work with people with eating disorders. I'm going to refer that out. And so the therapist has a responsibility in this as well to say, you know what, I don't know that we're a good fit. And so let me sit with you and see if we can come up with some references, some referrals, and maybe get you the right person to work on whatever this issue is. If it's it could be super severe, like you could have panic attacks and major depressive disorder and generalized anxiety, and still see a trainee. So it's severe beyond that trainee when it's out of their scope of competence. And so that varies. You might have a trainee who could see anybody because they're pretty competent. They've done a lot of extra work. And then you might have someone who, because of their own situations, they're limited in what they do. Some of us love working with couples. Some of us love working with children. I love working with couples, but I don't work with children. So even as a trainee, I would have referred most child cases out because I don't have that specialty training. And so as the consumer, it's hard, it's challenging. It's hard to figure out who's the right therapist to go to, and can this person handle what's going on with me? But I would say there being a trainee is not reason enough to think they can't handle it. I'm often willing to give it a shot, give them a shot, and then it's more about, are we a good fit? Are we a good match? And being in the space with that person is the way you can find that out.
Something I'm taking away from what you're saying is that a lot of it depends on the level of care that particular client needs. So if I'm a trainee and I have a client come to see me who's actively experiencing a psychotic episode, that person needs medication management and possibly hospitalization, and I don't do that. So I need to get them to somebody who does. Or if I see a client who has an eating disorder, they probably need an intensive outpatient program. I don't do that, so I need to get to see them to somebody who does. But they have to be in front of me to figure that out.
They have to be in front of me to figure that out. And even as a trainee, I've already learned enough to know that.
Right.
That's why you don't see a client until you've had that first year of training, because these are the things that you learn in school. You learn how to recognize those things, how to assess for those things, and then how to make those calls and how to advocate on your client's behalf.
That's great. That's great. So I can be safe seeing a trainee, especially if I'm struggling, maybe affording therapy, and know that I'm going to get connected to the level of care I need.
Absolutely. That trainee has someone working with them, and after you meet with them, they're going to share what you've shared with them on some level. We have to keep as much identifying information private as possible, but they're going to share with their supervisor what they learned in that session. And that supervisor is going to work with them to make sure that they're coming up with the best treatment plan for this client, and or referring them out if they're not an appropriate fit.
Okay. So I guess kind of a connected question is, what if I'm not sure I can afford therapy?
Yeah, that's a big problem. So there are organizations that are working to raise money to be able to assist with that. Being a nonprofit organization can help with bringing in funds, but we're finding that there are nonprofits all over the country that are trying to connect people with therapy. So find a resource link like Connect OC. Right, they have a list of resources. A Way Through is a nonprofit organization that is, we're telling stories and helping to destigmatize mental health care, but also trying to connect people with the care that they need. And so we may work with someone to go over their insurance providers list. So if you don't think you can afford therapy, can you get therapy through your insurance? If you don't have insurance, is it because you're not working? And if you're not working, can you get Medi-Cal or Medicaid, depending on what state you're in? If you're in Orange County, Cal Optima is a great resource. And so maybe you will go to your insurance company. However, a lot of therapists don't take insurance. So then we're going to be doing things like going to universities. Hope Counseling Center is a low-cost counseling center. They sliding scale between $70 and $20, starting at 70, sliding scale down to 20. CIF, the Center for Individual and Family Therapy, is another organization. They have licensed therapists all the way to trainee therapists, and they can sliding scale down to $50. So there are resources out there. There are organizations out there. There are some that are pay what you can. There are therapists out there who will do pro bono work. You may be seeing a therapist and have a life change, and financially, where you once could pay for therapy, now you can't. Your therapist can make some adjustments to your rate, so talk with them about it. And then you can also talk to family and friends. I've been really surprised at how many of my clients have asked me if they could pay for someone else to have therapy, because therapy was so helpful for them, which is why we started A Way Through, because people want to pay it forward. People who have means want to be able to help those who don't. I've had people whose grandparents were paying for therapy. I would certainly pay for my child or one of my grandchildren to get therapy, or a niece or a nephew, because I'm in a position where I could help with that. We still might have to go to a low cost therapist, but I could still maybe help with that. And so talk to the people in your life and let them know what is going on, instead of giving me a Christmas gift or a birthday gift. Donate to this account so that I can pay for therapy.
That's good. And I think of too, here in Orange County, a great resource. I know that one of my colleagues has posted about the link to the Connect OC resource directory, as you mentioned, Jackie, but we also have family resource centers dotted throughout the county. If you look at FACT OC, I have to double check on the website, but it's a great place to start. The OC links is a 24/7 number you can call, connected to the Orange County Healthcare Agency. We'll post that in the chat as well. That can get you connected to resources. And also, I thought of just as another possibility is the faith community. If you are a member of a faith community, there may be someone in your community who provides therapy, who can connect you to resources. And I've heard of faith communities paying for members to go and attend therapy.
Absolutely. I'm here right now in Fullerton, Fullerton Free Church, which used to be EV Free Church. I think it's off of Brea Boulevard. They have a peer counseling program that's a free program, 15 sessions meeting with the peer counselor. The peer counselor has had a year training. They're not professional counselors, but they provide that service, and you could have actually up to 3 sessions. They have some parameters around how that works, but they're definitely an option, and they have a list of resources they could also connect you to. And the many churches have that. I work with several churches. I have at least 3 clients right now whose churches pay for their therapy. Full out.
Fantastic. Great. Well, thank you for that. I think that was great. That was a nice, robust start for our conversation. Maybe we can shift over to kind of the general topic of self-advocacy. In the first question, I think it's especially important when we're thinking about engaging therapy is, what does it mean, or what does it look like to seek out a culturally competent, responsive, and engaged therapist? How can I ask my therapist to incorporate my culture into therapy? What role might I play in educating my therapist about my culture? What role should they play in educating themselves? What does that look like?
So it looks like being willing to have the conversation about culture. I think it's, on one hand, the therapist has to be open to it. And so being a culturally competent therapist, to me, is being a therapist who is open to culture, period, right? Open to the reality that culture exists, and that there are cultural differences, and that those differences are significant, and that they matter, and it impacts a person's life. It impacts their context. It impacts some of the things that they battle, and how they would respond to them look different because of their culture. And so I think as a therapist, it's important to have an awareness of that. That, to me, is the important piece, because none of us as therapists are going to be culturally sound and competent, completely understand every culture. So what I do is I make it known what I do know, and that I am aware that there's so much more that I don't know, but that they are the expert on their life. They're the expert on their system. They are the expert. I might be able to shed some light from an academic perspective, from a psychological perspective, but I need the person in front of me to share with me who they are. And I want them to share with me all the parts of them. And so I try to make it safe and comfortable for them to do that. That might mean things like when they drop an F-bomb, say a curse word, that I make that okay, because they're now apologizing. Oh, I'm so sorry, ma'am. I'm so sorry. Well, this is your space. We might get to the place where you don't feel the need to use that language at some point, because you've dealt with some of the things that are making you so angry right now. But don't get caught up on trying to protect me from you. And I think sometimes people of color are trying to protect others from the culture. And so I just encourage people, show up as who you are, be your authentic self. And if you aren't sure who that is, use this time with your therapist to start figuring that out. As a therapist, and I know you've probably heard me say that we don't get to tell our clients that what they are experiencing, they're not experiencing, right? So if a client says to you that they had a experience of racism, and you hear it and you think, I might have said something like that, but I'm not a racist. Are you sure that that was a racist comment? Are you sure that they meant it that way? No, we're not going to do that. We're not going to challenge you on what your experience is. We want to make a safe place for you to come and talk it out, because it might not seem rational or reasonable to me, but I've never been where you are or who you are. And so I believe that as therapists, our being culturally competent is our being open to that. We don't know it. We don't know everything. We don't know what's going on with that particular culture, and that we all have our own biases. And so I'm open to the possibility that I might be bothered by something someone says because of a cultural difference. That's a me problem, not a them problem. But I'm going to be honest about it with my client, because that to me says to my client, oh, she can talk about this. It's not their problem, it's mine. And because I'm reacting to it, I want them to know I'm reacting to it, because that might be what they're experiencing out in the world. And now we can talk about it. And sometimes therapy is the only place you can have those hard conversations. So if you're a therapist, be that space. Do your own work so that you can be that space for your client. Who's responsible for the teaching here? I think that as an individual, I am responsible for teaching my therapist about who I am. I think as a therapist, I am responsible for learning all that I can about all that I can, so that I can be as supportive as possible to my clients. Now, that doesn't mean I'm going to learn everything about everything, which is why I have to be open to the fact that I don't know it. I don't know everything. I know what I do know, and what I'm comfortable with is that I'm open to learning about you, your story, your experience. And also, I think it's important to realize that none of us are monolithic, right? I am a Black woman. I might be sitting with another middle-aged Black woman, and we could have completely different life stories. I grew up in LA. If she grew up in upstate New York, we are going to be nothing alike, right? So I can't make assumptions that I know her. So even if you're in the same culture, and I say that because there are times when some of our white therapists miss other white therapists culturally, because they don't understand that person's experience, whether that's because of faith or what it means to be a mother, or to have chosen not to have children, what it means to have little kids, or to be retired, right? There are just so many things that have cultural implications that we don't put our eye on. And so it's not just about race, it's not just about ethnicity, skin color. It's also about phase of life. It's also about level of your social economic status. There are so many things. Athletes are that's a culture of its own. Being in the military, right? That's a culture. The Air Force is a different culture than the Marine Corps, but all the branches together is a different culture than the civilian world. Being a part of law enforcement, being firefighter. So culture matters, even in terms of your job. Because sometimes we don't make it on our jobs and our careers because we don't fit that culture. So I think it is important for both sides. I think we as the patient need to show up fully and not expect people to just know us and understand us. And I think we as the therapist need to be open to the fact that we don't know everything, we don't know it all, and we are there to learn. And as we learn about our client, then we can come alongside of them and help them manage some of those hard parts of culture.
Yeah, that's good. Yeah, there's a dynamic at play, right? We touched on earlier, and I think we'll talk a little bit more about it in a minute, but the idea of therapy being a collaborative experience. I'm wondering, well, I want to check in with you for a minute, because I know that due to some technical difficulties, we started a little late. And so I want to see, what's that?
I'm good time-wise.
Okay, great. Maybe what we might want to do to the rest of my team there, I don't know if at some point here we want to share the survey just in case folks have to go at 3, but if it makes sense, I think we can keep going. And if you have the time, great. So then pushing forward, what does it look like then for therapy to be collaborative? Why is that important? What do I, as the person attending therapy, bring to the table that would make therapy collaborative?
Yeah, I love that question. Therapy is collaborative because it's relational. No matter what model, whatever theory a therapist uses, the very first and most important component is always the relationship. Build a therapeutic alliance, build a therapeutic rapport. And so the relationship is super important, and relationship is collaborative. I bring my parts, you bring your parts, and together we have this new whole, this new third, whatever the space is in between the two of us. And so the way that I like to do therapy is I want to find out as much as I can about my client and the problem that's brought them in to see me. And because I'm getting to know them and I'm feeling what they're feeling in the room, I'm open to who they are. I also want them to share their thoughts on a plan. What's worked in the past? Let's not do that. Let's try some of these things. There are some things that I'm almost positive will work because it's my specialty. It's what I do. It's what I love. But just because I believe so strongly in it doesn't mean you're going to be convinced of it. So if we're not collaborating, I'm going to ask you to do some things and you're going to be like, no, absolutely not. You might tell me in session that you're going to do it, but then you're going to go home and not do it. So I like to collaborate. I'm going to say, what do you think about this? And give you the opportunity to say yes or no. And the reason why I will make the offer of an idea is because people are coming at therapy because they don't know what to do. So as a therapist, for me to sit and just say, okay, well, so how are you going to handle that? What are you going to do about that? You're going to say to me, actually, I had a client say it to me last night. I was like, so what do you think you should do? He was like, I don't know. That's why I'm talking to you. Which made sense, right? If he knew what to do, he wouldn't be in that problem. But I don't know everything because I'm not you. So we have to work together. I can tell you what I think. You've got to tell me if you can actually do that thing or not. If you're a person who absolutely hates homework, once you say to me you hate homework, it doesn't mean I'm not going to give you things to do outside of therapy. I'm not going to use the word homework though, because something happens in your brain when you hear homework that means you're not going to do it. So now I've learned that. To me, that's collaborating. You've taught me that I can't say you got to do homework, but couples therapy works when you do homework. For me, it's a requirement because I only have you 45 minutes once a week. Got all the rest of those hours to be working on your life. So I'm going to ask you to do some things outside. I just won't call it homework. And I'm going to offer them. And then you get to say, yeah, I think that'll work. And then when you come back, we're going to talk about what I thought you should do. And you're going to tell me what you did. We're going to talk about whether it worked or not. And we'll make the adjustments. Sometimes we're negotiating a timeline. I want you to do this 6 days a week. You might tell me 3. Okay, you know your life. You know that you can't do it 6 days a week. I can want that for you. But the collaboration is important because you have to buy in. It's your life that is changing. And so if I say, read this book and you don't like reading, I'm not helping you. And that is why I believe that therapy has to be collaborative. And often clients don't realize how much input they are giving in their own therapy. And so when I do my check-ins every 6 weeks or so, I like to feed that back. Well, you did this and you did this and you did this and you did this. And they don't see all the little changes, but they will think that the therapist made all these things happen. So we're a team and you're doing the heavy lifting.
Right. Yeah. I'm only doing it, like you said, I'm only here for 45 minutes, 50 minutes a week. You're living the other rest of your life, the other 6 days, right? Yeah, that's good. Yeah, therapy, the idea that, which I think is empowering, that I'm not just coming for somebody to fix me. I'm bringing my life with me. I am you said earlier, I'm the expert on my life.
Yep,
right? I know what's going to work for you. It's not going to work for me.
Yep.
I'm coming to partner with somebody who has a different set of skills and expertise. Might be able to shed some light. But
I love the way you said that. Yes.
Great. This is connected. And this is maybe a bit more general question. What does it look like for me, or how do I advocate for myself in therapy in general?
So I tell my clients pretty much the first session during informed consent, I might miss something. I might get it wrong. If I do, you have every right to tell me so. Please correct me. Or in a session, we might be talking about something and I may take something that someone has shared with me, and as I'm reflecting it back, I get maybe an understanding of it, or I come up with an idea that I think they should try. Or I might think, you must be feeling whatever. I'm going to share, so here's what I think is happening, but tell me if I'm wrong. Because I'm trying to teach my clients to speak up for themselves and to be able to advocate for themselves. And even though they see me as Dr. Jackie and I'm the expert, they get to say, no, you missed that. You don't know me better than I know me. Yes, I'm struggling with some stuff, but that's not what I'm thinking. That's not what I'm feeling. And so to advocate for yourself is to say, I need this from you. It is if you feel like you have a therapist and there's not a consistent schedule, and for you, you need to have it the same time every week, you can say to your therapist, this doesn't work for me. I've had people come to me that had been seeing someone else and they say, well, I'm just not going back to that therapist. And I'm going to talk to them about why they're not going back to that therapist and encourage them to go advocate for themselves. You've been seeing this therapist for a few months and you don't think it's really going anywhere. Tell them that. Tell them that you don't think it's going anywhere and let them get curious about that. We're trained to be able to sit in that and to have our clients say, I'm upset with you, or I don't like that you said that. We call it a rupture. And a therapist is trained how to work towards repairing that rupture. And that can also be beneficial as a marriage and family therapist. I'm thinking about they're going to take that skill outside of this therapy room and use it in their other interpersonal relationships. So they just learned something because we had that disagreement. And so you speak up for yourself. You share with your therapist when something isn't going well, when they've disappointed you, when something they've said has hurt your feelings. And they're also human. And by the way, therapists are also going through whatever you're going through that's happening in the world. And so we've all been therapists in the pandemic. And so while everyone else was feeling super anxious and overwhelmed and depressed and all the things, so are therapists. And so sometimes they are having a bad day or an off day. I've actually had clients call me out on off days back during the summer 2020. I thought, okay, I've gotten through the weekend. Monday morning, I can actually see clients. I'm going to be fine. And first client popped up on the screen and he looked at me and he said, you are not okay. What's wrong? And it was the week after the George Floyd murder. And I'd been working really hard to be okay. And he popped on and he said, you're not okay. And I don't want to talk about anything else but that. And so as much as I tried to redirect and make it about him, it wasn't. And then his wife texted me and said, he said, our Jackie is not okay. And that's what therapy had to be about that day, because that's what he needed to do. And that was hard for me as the therapist, because I don't want my clients having to take care of me. But I had to see that my client sees me as a human being, and I'm trying to teach him how to be with other humans. And if I'm going to be honest and authentic in the ways that I show up so that he learns how to do that, I had to give him that day. And I think he learned that it is okay to push back a little bit, because I was like, I'm fine. It's not about me. He's like, it just wasn't working for him. He needed me to be honest because he was feeling something in his body, and I was telling him that what he was feeling wasn't there. And he kept pushing until he got what he needed. So you do get to speak up. Advocating for yourself is just you getting to set boundaries and say what's okay and what's not okay. And we want you to learn how to do that outside of therapy, and inside of therapy is a great place to practice.
That's great. I can see some of the things I'm picking up and hearing is, there's very few spaces in our lives where we can exercise our voice without some kind of consequence, right? Because so often when we exercise our voices, that means somebody else has to do something, right? Or at least that's how it feels for other people. So for us to be honest, so many other areas of our lives, for us to be honest with someone, even brutally honest, just means conflict. But in therapy, we get to experience something different.
You get to be heard, right? You get to be heard and responded to. It can be a really corrective experience for someone to finally say, no, that's not it. And to have a person go, oh, wait, I'm sorry, I misread that. Tell me more. And have them lean into them and be even more engaged with them rather than get angry with them and shut them down and cut them off and go away. Can be a really corrective experience, a really healing experience for people. And it's definitely one of the things I try to teach my clients to do for themselves. You have to learn to advocate for yourself at all ages and within your relationships. It's hard to do that because you don't want people to be mad at you.
Okay, good. Maybe we can shift and then kind of into our last section and and explore the therapeutic process in general a bit, kind of what that looks like, what we can expect. For everybody out there who is attending, who's watching, there was a post that went into the chat about where you can fill out the survey we talked about earlier and be entered into that opportunity drawing to possibly win or receive a gift card. So I'd encourage you to do that to help us make sure that we're offering good, more good stuff like this. So thinking about the therapeutic process, I guess the first question, kind of maybe a little quick overview of what does the therapeutic process generally look like?
So you call in and leave a message. They call you back. That's been hard these past couple of years because the need is great. The idea is you get an appointment, your appointment is scheduled. Generally, you show up in some centers, you will show up for an intake appointment at which the therapist that you are seeing is gathering a lot of background information and psychosocial information, and then you'll meet with your therapist in the next session. In my practice, I do my own intakes, my associates do their own intakes. And so you call, you schedule, we get you on the calendar, you show up, there's some paperwork that needs to be done. And since things are digital now, you'll get an email, and in that email, you will have, it's a portal, so portal access. So you get your portal access, you complete all your paperwork. That's important because that paperwork is giving permission for the work we're going to do. Just like if you go to a doctor's office or you're in the hospital, you have to give consent. So that first session should be, at least the first 15-20 minutes should be going over that paperwork. Let's talk about informed consent, what you can expect in therapy, what if there are any rules that the practice has. We're going to talk about confidentiality, privacy, and so we'll go over those things, I typically explain the type of therapist that I am and what that means. And I will then ask my client to share with me what brought them in. In that conversation, I'm trying to find out who my client is, where they come from, what their family of origin is like, what problem is coming up in their life that's causing issues. When we have some understanding of that, once I've got that information, I'll usually ask if they have any questions about me. I'll tell them a little bit about how I do therapy. And then we set a plan. Here's something, and I usually in the first session, I want my clients to leave feeling like something's better than before they came in. So even though it's our very first session and we've got a long way to go, you're probably going to learn a communication skill. We're going to talk about being a good listener, and we're going to talk about mirroring and validating and empathizing, whether it's an individual or a couple, but especially if it's a couple. So your session is going to be, that very first session is a lot of information giving and receiving. And then we set up some times to meet. And then typically we meet weekly. And with my clients, I meet with them every week. And once we started to achieve some of the goals that we've set, then we go to every other week. And once we feel like, okay, every other week has worked for a couple of sessions, so that's been about a month, we'll go to once a month. And some people stay at once a month and they just do a check-in from now on until they decide they don't want to do that anymore. And then sometimes we terminate and they can schedule to come back whenever they want to. The door is open, they can always reach back out. There's some things that we talk about in that first session that I think are important. Therapy is confidential. No one can have access to your information without your written consent. So whatever you share with me stays with me, except for in some special circumstances. I am a mandated reporter, so if there's any discussion of child abuse, including viewing child pornography, dependent adult abuse, or elder abuse, I'm required by law to report those things to Adult Protective Services or Child Protective Services. And if there's any homicidal intent, then I am required to do whatever I can to protect that person. If there is suicidal intent, then I am required to do what I can to protect you. And we're going to talk about that before we talk about what brought you in. so that you have an understanding that what you share with me might be things I have to share with someone else. We also have either supervision or consultation. If you are pre-licensed, you're going to be in supervision. That means you're going to be sharing every case with your supervisor. We don't use identifying information. I have my trainees give first name, last initial. That way we can just make sure that you don't know the other person. And if in our group, someone in that group recognizes the name, they leave. And so they're not going to stay and hear about the other person because of confidentiality. So we in consultation, same thing. I might meet with other licensed professionals, and we do that so that we can make sure that we're using best practices and that we're on the right track with our clients. Therapy last session is 45 to 50 minutes. Some trauma work and couples work therapists will their sessions are just routinely 90 minutes. Mine are 45 to 50 minutes routinely. And then I might do a double session if there is a lot of trauma or a lot of contention in a couple. Couples therapy, individual therapy, therapy with children, young adults. There are so many different models we can use. And so one of the models is CBT, cognitive behavioral therapy. We're looking at a person's way of thinking leads them to believing certain things, and because they believe those things, they behave in a certain way. Those behaviors or actions lead to consequences. We want to change thinking, so we can change what you believe, so we can change how you act, and so you get different consequences. So that's kind of CBT in a nutshell. And so you might meet with a therapist who is going to help you make behavior changes. And so then in your session, you're going to practice those skills. And so if I'm talking to you about maybe thought stopping, I'm going to have you share with me maybe some negative thoughts that you've had, and then talk to you about what you can maybe do instead. What are some ways you can change that thinking? What's a opposite thought or a more true thought about yourself? And so therapy is, there's the technical parts of it, and the therapist is usually holding that, but really it's a space of sitting and being with another person. It's a conversation about one side of the, the party, one person's life, and then there's the reflective aspect from the therapist as well as the person, right? So I could share with you, David, if you were my therapist, I could share with you, you're going to reflect back to me. And I might also have some reflection, because now that I've said those things out loud and I've watched your response to the things that I've said, my wheels are now turning and I'm going to start to think about it differently. So that's what therapy feels like and looks like in my practice and in my experience.
That's great. That was a really nice, cohesive summary of what can be like a months, years-long process, depending on what somebody is going on. I think it's probably fair to say that it's typically more of a months-long process, maybe, depending on what's going on, right? But some folks choose to continue going for some time, right?
So when you come in for a problem, right? If someone came in therapy, say they had a panic attack, and now they're worried all the time they're going to have another panic attack. So they're going to come in and we're going to work on some behavior modification and just some working on the way that we think about things and learn some coping mechanisms. And that might be short term, right? So you might be looking at 6 to 12 weeks of therapy. In my experience, probably about half of my clients have kept some ongoing therapy. So maybe we were meeting weekly in the beginning, and once they started to feel good and like they hit their goals, we're at every other week, and it's just continued on at every other week. I've had other clients who have we've terminated or we've gone to every other week and they've come back to once a week. So I have several long-term clients. Part of that is because I think part of that is because I was trained at SIFT, and SIFT is very psychodynamic or analytical, and that is a much slower work. And so I do, even though I'm very attachment oriented, I think that we learn to be in relationship in our infancy, and I'm conceptualizing every case through their system and their ways of attaching. And so all the interventions that I might do are going to somehow align with that, but sometimes that's really slow work because it's really about creating this attachment here, making this relationship between me and the client, and then helping the client to do that well in other places. and that can take some time. Also, I found that we might address one issue. Say, for instance, the example I gave with panic. Well, we've worked on the panic disorder, but in the working on the panic disorder, the history of child abuse came up, and now we're working on that. And as we're starting to reveal the things that happened in childhood, we might also start to see that there's some generational trauma, and we want to deal with that. What dysfunctional behaviors came out of that? So now we're dealing with that. So if we only had one thing to deal with, that 6 to 12 weeks might be it. But because we're such complicated creatures, therapy can go on if you find that there's something there. I will tell my client, if there's nothing really, I don't see anything more for us to work on, is there anything else that you would like for us to focus on? And they have the option to say yes or no. I've had some clients say, oh yeah, I want to start working on this now. But I've also had some clients say, you know what, I was thinking that too, and I think I'm good. And then they're good and they'll come back when they can. So it really depends on the individual and their life circumstance. Their family of origin plays a role. And so you can be dealing with a problem, or you can be dealing with your life.
Yeah, yeah. There's a sense in which sometimes as you begin digging in, you find that there are things underlying the stuff that's on the surface, right? So there might be more to work on, but.
And sometimes the cure then creates something. So like I said, I work with attachment. So if you're an emotional avoider and you're just closed off to emotion, and you thought that was great, but now you're finding out in your relationships that it's not. And so now you start to do this work so that you can be more present and show up. Now everything is harder. Mm-hmm. And so we maybe have fixed one issue. You're showing up for your children, you're showing up emotionally in your marriage, your relationships are better, but now you're feeling all of that all the time. And that's not something you've ever enjoyed, which is how you became an avoider. So now we have to deal with all the coping. How do you show up, be present, be attuned to others, and not be drowning in emotion all the time? So sometimes we fix one thing only to open the door to something else. And then it's just, coping mechanisms and skills development.
It is safe to say that through that process, though, we're digging a way forward, a way through, we might say, to a richer life, to more flourishing, right? It just sometimes means the road is longer than we first thought.
Absolutely. I truly believe that. It's an ongoing journey. And often what I'm finding, the people who I have one client who was my second ever client. She was also my client that I saw on my 3,000th hour, right? We've been at this for a while.
Yeah.
But she has been growing and growing and growing. And so I've just got to be with her along that journey. And from the very beginning, I remember saying to my supervisor, I don't know what to do. Like, there's nothing for me to fix. And my supervisor said, be with her. That's all. She just needs you to be present with her. And she has grown so much over the years of me just being with her, because it gave her the mirror she needed to see her reflection in and go, oh, no, that I don't want that to continue to be that way. And then she focuses on that. And then months down the road, in her continued work on this thing, something else is revealed. And she's working on that. So therapy for her has really been support for her growth. As she's been on this journey of personal growth and development, she's used therapy as a safe place to land each week, just to kind of process what she's going through. There's no concrete problem. There's no diagnosis that we're addressing. It's all interpersonal. How do I continue to be with people as I'm continuing to become who it is I am, or I'm going to be? Because she just keeps growing, as we all do, I think.
You've mentioned a couple different approaches to therapy. You talked about attachment. You mentioned CBT. I know a big thing right now, especially as we're becoming more aware of how pervasive and the trauma is, and the impact of trauma, EMDR, and some of those other trauma body-centered kind of approaches. for me, as somebody who's looking to see a therapist, how do I seek out a therapist who utilizes an approach I'm interested in? One, and two, why should I be open to other approaches? Why should I be open to the idea that maybe EMDR is not what I need? Something like that.
So if you are aware of the different approaches and you have one in mind, like EMDR or cognitive processing therapy, prolonged exposure, those are all good trauma therapies. If you are familiar enough with them to know the name of it, then Google the name of it, and whatever associations are out there will pop up. So if you are looking for EMDR, you're going to go to EMDRIA. And EMDRIA is going to give you a list of people who they've certified. If you are a couple and you're looking for couples therapy and you've heard of the Gottman method, you're going to go to that website and they are going to recommend a therapist for you. Sue Johnson, any of the theorists, any of the models are going to have a website and they're going to refer certain people based on people who use that model. I use How We Love. So Relationship 180 uses How We Love. If you are looking for a therapist who specializes in How We Love, you're going to Google How We Love and you're going to go to that website and it's going to give you direction on how to figure that out. But why should you try a different modality? Well, if someone says to you, "Oh, you should try EMDR," I would recommend you look it up and learn what you can about it and have some conversations with people about it. And just with anything else, get a second opinion. Right. So if you're meeting with me and I tell you I think you need EMDR and you look up EMDR and that looks hokey to you and you're like, I don't know anything about this, talk to your psychiatrist, talk to your primary care doctor. Make an appointment for a consultation with another therapist who maybe specializes in EMDR, but isn't in the state, so you can't see them. Get another opinion. If you are unfamiliar with the different models, then when you're looking for a therapist, and I would say you could look at different directories if you're looking for a therapist. So one, you'll get whatever the directory is your insurance company has, but on things like Choosing Therapy or Psychology Today or Therapy for Black Girls, those websites, the providers, the therapists will tell you what their specialty is, what their motto is, how they do therapy. And so sometimes part of getting a therapist is hard because you're having to dig through all of that. And so it can be helpful to have someone that can advocate for you. That's why those directories are helpful, especially organizations like Choosing Therapy, Therapy for Black Girls. I know there's a Therapy for Black Men, and there's probably a plethora of others, but those I know specifically because I've engaged with them. They do a thorough work on vetting their therapists, and the profiles are pretty meaty. So you could learn a lot about the therapist you're wanting to see by viewing their video on Psychology Today or on Choosing Therapy, or just reading through what are some of the things they've done. And some will have testimonials. Their websites can share that information as well. You can find out what models they use. Generally, we will put that on our website.
Yeah. So I'm hearing is if you have a model that you're interested in, you can kind of look up the organization that is the kind of lead organization for that model, and they'll have some references. But if I don't know anything about that, I'm still good. I don't need to know about that to do therapy.
Yep, you're still good because your therapist knows about it. If your therapist is using EMDR, they're trained in EMDR. We're not allowed to use models that we don't have training in, and we wouldn't want to. Right? If I'm not good at a particular thing, so I don't work with children. I don't do sand tray. I don't do play therapy. There is a way of playing with children in therapy that produces psychological results, and that's a skill I don't have. Right? So I won't put someone in a situation where I'm faking it in that. And I think that that's true in general of therapists. We are taught about all these different models, and one of my professors in the past, Lisa Lisa Wilson used to say we're dating the theory. So as you're in school, you're just learning about all the different theories and models, but over time you pick and you become, or it picks you, and you start to focus, and then you dig in and you train a little more and you specialize, you become certified in certain things that matter to you, and then you're going to be registered on those directories.
Yeah, that makes
So
sense.
even if you were sitting with the therapist and you didn't know about a model, the therapist would share with you. So I'm going to talk to you about EMDR. I'm going to do what we call psychoeducation. I'm going to psychoeducate you about it, but I'm also going to ask you to go home and do some more research, because we're not going to start until you're comfortable. That's the collaborative part for me. I won't do EMDR or other trauma treatments unless it's the one you're choosing. And there's a few that I'm trained in, and so we have options. So I'm going to go with whichever one feels most comfortable for my client.
Yeah, it's again about that bringing the client in and making therapy collaborative, right? Yeah, I know that I've seen before on some of these directories that, you know, a therapist might list a particular approach they use, but they also invariably list, like, here are the situations I work on. You know, I work on trauma, I work on depression, I work on anxiety, or whatever it might be. These are the areas of experience I have, right? So for me as a person looking into therapy, I can look to that if I don't know anything about these different approaches.
Yeah, and that's typically, I think, what people do. You're going to look at a therapist and you're going to say, I'm feeling anxious, and okay, this therapist works with anxiety. If I'm looking at a profile and anxiety is my issue and I don't see anxiety anywhere on there, I might not know enough about what's going on with me to even decipher. And so for a lot of people, you just don't have enough experience to know what you don't know. And so what you're going to be really thinking about is, do I get along with this person? Is it comfortable? And so we'll ask questions like, does it matter if it's a male or a female? Does it matter what day of the week or the time? So for the person seeking out therapy, you might have to take a bunch of other things into consideration because you know so little about therapy. So think about the other aspects of your life. What will work for you? Do you need a therapist that works on the weekends or at night? Do you need a therapist that works with couples? And so those kinds of things I think can be important, because a lot of the diagnoses that we would work with or experiences that we would work with, some people might not even understand what those mean yet, but those are definitely going to be on our sites, right? So on Psychology Today, you'll see that I work with military and with ministry and with adolescents, but you will not see that I work with children. And if you do, email me so I can fix that because it shouldn't say that.
That's good. You know, we mentioned here in this conversation just now quite a few different possible diagnoses, right? Anxiety, we talked about panic attacks, depression, that kind of thing. You know, what does it mean to receive a diagnosis, you know, as a person who's attending therapy, who's participating in therapy? And how should I approach exploring a diagnosis with a therapist?
So I believe that receiving a diagnosis means that we now have a way to name this experience that I'm having. This combination of issues or symptoms is called this. Now I know how to look for help, because if you tell me my problem is ADHD, now I can start to deal with the ADHD from a perspective of, I'm challenged, but I'm challenged because my brain is made this way. So I need to focus on doing certain things. And so the way that you discuss that with your therapist is you just flat out ask them, what's your diagnosis? If you are a person who wants to know that. Some people don't want a label and they get really offended by labels. And so especially in the MFT world, many of us don't do diagnosing because we're there to work with you interpersonally. I personally believe that it can be helpful to have and to know. I'm a researcher. I love knowing things. I love knowledge. So if you tell me that this is my problem, oh, now I can address that thing. And it also makes the issue, the diagnosis, right? So my issue is ADHD. My issue is anxiety. My issue is depression, rather than I'm a problem. And so I think that it separates the issue out from the person. And so I will diagnose a person, and even if it's something like adjustment disorder, they're coming in and they're super anxious or depressed, and they're beating themselves up because they're not good enough and they're overwhelmed and they should just be able to handle this. But then when I break down, well, we've been in a pandemic for this long and you had 2, 3, 4 deaths. Wow, that's a lot. You lost your job. So you had to start a new job in a pandemic while dealing with the grief of 4 losses, right? Like, you're having a hard time adjusting. There's a reason for that. So then we can make sense of it. It's easier to make meaning of things, at least for me, when I know what to call it. And so diagnosing is simply just the label we put on a set of symptoms. It is not a label we put on an individual. And so I'm not going to say you're depression, right? You might talk about your depression as this other thing, but not you're depressed, right? And we say those things, it just rolls off the tongue, and it's the way that we talk about things, but we often don't realize how much what we say our brain takes and uses, and it becomes your truth. I'm always depressed. Guess what? Your brain just heard you say you're always depressed. It will prove you right. But if you are saying things like, I struggle with depression sometimes, it's this external thing that we can come over here and deal with. And it's not something that you are all the time. And so when I talk about diagnosing it, for me, with my clients, it's to get it out of them, because that's not all that they are. But I'm big on authenticity and owning your own story. So if it's true that you've dealt with depression your whole life, we're not going to lie about that and pretend like you don't. We're going to call it what it is, and we're going to point at it as a problem, and we're going to address it as a problem. Because I believe that people don't address things that they don't have. And so if you can't even say you're dealing with depression, then you're not going to do anything to change it, because you're fine. You're fine. And sometimes that's coming from the family, right? Oh, he's just a little sad. Sometimes he's blue. You're fine. Suck it up. Okay, well, that works for you because you're not actually dealing with this depression. So when you look at the other person, you don't see it as seriously or as intensely as they're experiencing it, because it's not your experience. And so I want people to be able to point to what the problem is so that they can deal with the problem, but they're not having to live life as though that's all there is. I have ADHD and I'm a fan, right? You know me, I think it's a superpower, but it's not the only thing I think about in my life. But because I have ADHD, I'm aware that I don't do some things well. It's important for me to have had that diagnosis, because now I'm not shaming myself. I'm not beating myself up for some of those things that are executive functioning issues. That's a brain problem. If I had one leg shorter than the other and I walked with a limp, no one would think that I was doing something on purpose because one leg is shorter than the other. But for some reason, when we're dealing with someone with ADHD, we think they're not doing their work on purpose. They're forgetting on purpose, not understanding that it's a brain issue. So I want to teach you more about that diagnosis, but first we need to name this series or this compilation of symptoms or problems. We give it a name, and now we can actually beat it.
Yeah. I'm not OCD. I might have obsessive compulsive disorder. I'm not bipolar. I might have bipolar disorder.
Right.
But it's an aspect of my life. It's not who I am.
Right.
Right.
Who I am is that and a whole bunch more.
Yeah.
And
yeah.
A lot of times people struggle with accepting who they are. And I think that that's causing us mental health challenges, because we're trying to be something someone is telling us we should be, rather than be who and what we actually are. And sometimes that's because we don't like some of those parts. Those are the things we come to therapy and we try to make adjustments on. And I tell my clients, everything that we learn about you is not going to be something you're going to decide to change. Some of the things that we're going to learn are going to be problematic, but they're also going to be things like you're going to be like, well, That, yeah, that one I'm not even gonna worry about. I'm used to that. It's not my favorite, but it's a thing, right? Time management is a problem. And I'm not gonna take the time to address that right now because I got 10 other things I need to go do. Those are priorities. These are things I'm actually gonna work on, right? And so I give my clients permission to say, yeah, I don't wanna focus on that right now. I wanna focus on this. Because we are more than just one thing.
Right. Well, being mindful of time and wanting to kind of like bring it home a bit, kind of last question we have pre-written. If anybody else any questions, feel free to share them. If we can't get through them today, we will get you a response and get that out to you as part of our follow-up in some format. But the kind of last question is, what does success in therapy look like, or what might success in therapy look like?
So success in therapy looks like a person seeing themselves in a new light, in a new light that they want to see themselves in. So it could be a couple who came in, every time they try to have a conversation, they were arguing. 7 days in the week, they have 7 conversations, they're gonna have 7 arguments. So success to me looks like 6 arguments that week, 5 arguments that week. We are just trying to make a little change. And I think sometimes people are looking for a big drastic change. And success also looks like the people who are meeting with me are focused on the changes they can make in themselves. I tell my clients, if you want to have peace in your life, release others from the prison of your expectations, because your expectations of others are harming you, because you get nothing from expecting things of other people. They get to choose for themselves as you get to choose for yourself, and be you. Choose to do the things you want to do. We're not all out wanting to destroy the world. If that's the thing you want to do, we're going to have a different kind of therapy session. But really, if you can just be who you are, own who you are, and release others from your expectations, life is going to be so much more peaceful. And so for me, I think my clients are successful when they get to the place that they're focusing on their expectations of themselves and the changes that they can make for themselves and the growth that they want to have for themselves, rather than what someone else has done to them or is doing to them or won't do, and how that's making their life miserable. I think you're successful when you can focus on you, because that's all you have control over. The only thing you can change is you. Can't do anything about everybody else. You can just address how you respond to the rest of the world.
Yeah, that's good. That's good stuff. I know, connected to our last question with the diagnosis, that when we think about a diagnosis, kind of the two big markers we look at are how it impacts our functioning, that is the ability for us to be who we want to be, right? And does it cause us distress, or others around us distress? Does it cause problems in our life? So I think you just hit on, touches to, are we becoming the kind of person we want to be? And are we increasing functioning, if we want to say it in a technical way? And is the distress diminishing? Are we feeling better about life and who we are and the people around us and our relationships and all of that?
And so often our distress is diminished when we let go of, right? Because many of the people that I'm working with are not addressing stuff of their own. They're struggling because of things other people do. And so our work is them accepting that, even though for some people it's really hard because that's wrong. They shouldn't do that. And the fact that they do that makes me miserable. All right. And so if that is causing you distress, that's a thing about you that you have to work on. So a lot of my work is getting people to become inwardly focused and realize you can't see yourself the way others see you. And that person doesn't see themselves the way you see them, but they're not your issue. And if you can focus on minding your business, for me, just getting them to focus on them, sometimes that in itself is success.
Yeah. Some greater awareness and ownership who we are.
Yes.
Yeah.
Self-attunement, becoming self-aware.
Thank you. This has been really, really good. We shared a way through in the chat. Is there anything else that would be good for us to share with folks to help them connect with you, or that you would like for them to know about?
Well, definitely the website. My practice is The Bridge, Marriage and Family Therapy. Fullerton Free Church is a great resource. Hope Counseling Center is a great resource if you're here in Orange County. There are a lot of excellent therapy practices. You could also go to OC Camp, to their website, and look for therapists, or CAMFT, the main CAMFT website. And I just want to say thank you to you all for doing this. I love that we are working together to help destigmatize mental health, to help people answer some of these questions.
Thank you. Thank you for sharing your expertise and your time. Quickly for everybody else, I don't know if I looked through the chat, I didn't see any other questions. If there's anything that I am missing in terms of questions, we invite you always to connect with us via the connect-oc.org website. We have a spot there where you can reach out to us and you can share a question. We can connect back with Dr. Jackie and see if we can get an answer to that question and get it out to you, or see if we can get you some other resources. Again, we'd love for you to be able to fill out the survey if you have the opportunity. The link is there in the chat. And just a couple of heads up. If you enjoyed this, in about a week, on Wednesday, May 25th at 5 p.m. via Zoom, we are partnering with Be Well OC to host an event focused on student athletes and mental health. There's been lots of talk about the mental health impacts of COVID and so many other things that have happened over the last couple of years, and the ways that's impacted student athletes. We've had some very high profile athletes express their own struggles with mental health, as well as the steps they've taken to take care of themselves. And so we'll talk a little bit about what that means. We're going to be speaking with a coach or a couple of coaches, a couple of athletes themselves, and a couple of mental health experts on that subject. Also on May 27th, the last Friday of this month and last Friday of each month, at 10 a.m. via Zoom, we'll be hosting our monthly coalition meeting. And this month, for Mental Health Awareness Month, by the way, happy Mental Health Awareness Month, Dr. Jackie, and to everybody. We are going to be looking at the positive intersection of mental health and pop culture. Often we're looking at pop culture and its negative impact on mental health, or from a negative lens, but there's lots of ways in which pop culture can be in a positive reference for how we think about our own mental health and our own process of self-discovery. So we would love to have you join us either then or any other time. And you can always reach us again at the website, connect-oc.org, or email us at info@connect-oc.org. Once again, Dr. Jackie, thank you. And thank you everyone for joining us.
Thank you. Thank you all.
All right. Take care, everyone.
Take care.